Hi, I'm Dr. Sheikh. I'm one of the pediatric neurologists working at Medical Clinics of New York City. I am also a pediatrician. I trained at Lincoln Hospital, Bronx for pediatrics, and then went up to Boston Medical Center to do my pediatric neurology training. And now working at Medical Clinics of New York City. We're going to talk about one of the most common demyelinating diseases in children and adults. And it is multiple sclerosis. Multiple sclerosis is a demyelinating disease in which what happens is our own immune cells attack our myelin sheaths or myelin in the brain and the spinal. So what happens is basically the mechanism is that some of the immune cells that are supposed to be destroyed by the body ends up not being destroyed, escape that mechanism and make it to the brain, and the spinal cord hence attacking the neurons, especially the axons of the neurons, which are extensions of the neurons, which are used for cells to basically communicate with each other. And so once they destroy the myelin that protects those axons, the symptoms develop, then multiple sclerosis develops. And so the key symptoms in multiple sclerosis, one of the most common is actually optic neuritis, which is inflammation of the optic nerve because of the myelin being destroyed, and vision issues in the patients. And then we have weakness, motor sensory symptoms, gait problems, many other symptoms, including psychic symptoms such as depression, anxiety, fatigue, that does not localize to any lesions in the brain. So these are the symptoms that would give us the clue to work up most of these patients. Then there are different types of multiple sclerosis. We have the most common type, which is relapsing remitting type, which is when patients actually have the flares of attacks. The symptoms will come on, last a few days or weeks, or when the patients get treated, will completely resolve or partially resolve, and then go back and suppress, and then until the next flare-up comes back. So that's why it's called relapsing remitting. Then we have primary progressive MS, where a patient gets diagnosed and it's just decline. Within a year or two, they just go towards decline and worsening symptoms. Then there's secondary progressive, where patients usually have relapsing remitting. The episodes come, they go, they get treated, they get better or partially getting better, and then complete decline. So it gets progressive. Diagnosis. So we diagnose multiple sclerosis using MRI and the symptoms. There's a criteria called McDonald's criteria, which was last updated in 2017. It looks at how many lesions the patient has in the brain or the cervical cord, and in accordance with the symptoms. So, and then for those lesions, there are typical locations for MS lesions. So one of the locations is periventricular lesions, so they're around the ventricles. Then there are juxtacortical lesions, which are adjacent to the cortex. Also, some of the lesions are behind or in the back part of the corpus callosum, which is called the splenium. And then the lesions are seen in the cervical cord. So those are like very strong clues, to investigate and do further workup to diagnose. So that's what the McDonald's criteria uses. And then once we find those lesions, we quantify, see how many lesions. If there are 2 lesions with 2 episodes or 2 attacks of symptoms that point to the location where the lesions are, it's a clear-cut diagnosis. But then there are other ways when lesions are less or attacks are less. There are other ways we can diagnose them using the criteria. So it gets a little bit more complicated. Then we have, why is this important to diagnose the patient early? The reason being is that we've developed a lot of medications for multiple sclerosis. So the treatment can help reduce the risk of relapses or progression. So it gives patient more time with either less disability and hence the less progression of the disease. treatment options, we have two different ways to treat this. Either we do immune modulatory treatment, which is basically modulating these T and B cells that actually start this process, or immune suppression. We suppress the immune system using medication so that these autoreactive cells cannot attack the cells. Now, when we talk about treatments, there multiple treatments. It depends on patients. Each patient is different. Of course, we want the most effective drug, but we want the least side effects, and a lot of these medications have side effect. What I have found is in terms of being the most important factor is how often the patient has to take the medication, which affects a lot the decision on what medication to use. So some of the medications are monthly injections. Some of the medications are every 3-month injections. Some are once or twice a day. Some are daily. So it really depends. And then we have to look at the if it's a female, if somebody's pregnant, if it's a child, not a lot of medication. Actually, there's only one medication that's FDA approved that can be used for children above 10 years of age. So all these factors come into place when we make the decision of treating. But there are a lot of medication out there that can be used to treat these patients. Hence, it is very important. Earlier diagnosis means longer periods before the progression of the disease, hence reducing the disability, the time for patients to get to the disability. Living with multiple sclerosis is not easy. There are, like I said earlier, psych symptoms such as depression, anxiety. So these patients need sometimes depression treatment, therapies, even physical therapy. And then there's a lot of research that has happened and is ongoing for diet. So a lot of physicians will suggest Mediterranean diet, ketone diet, and also gluten-free diet. So all these actually have shown to be helpful. And then finally, what I did not talk about are the risk factors such as vitamin D deficiency, smoking, obesity. So these also are environmental risk factors that have been studied and are seen in these patients. And finally, there are also genes, which are HLA gene mutations that have been found in multiple sclerosis patients. But it has been thought that it is a combination of environmental factors and the gene changes that have occurred in patients that end up causing multiple sclerosis.